For those of you who don't know me, my name is Dr. Bronwyn Storoschuk. I'm one of the naturopathic doctors at Conceive Health, located within Evolve and Trio Fertility. And my clinical expertise is really within preconception care or supporting those people looking to optimize their fertility before egg freezing, trying to conceive naturally, or undergoing IVF. But my true passion really lies within metabolic health, and we're going to talk a lot about that today because I truly believe good metabolic health lays the foundation for optimal fertility. And that really starts at the health of the egg within our ovaries inside our bodies. And so I think that anybody looking to freeze their eggs or try to conceive in any way needs to really hone in on their metabolic health and do the things that are going to support them in a way to promote good, strong metabolic health. And so we're gonna jump right in. And so metabolic health, it's kind of a poorly defined term, but it's the way our body utilizes the fuel from our food. So if we eat food, it's broken down into its simplest form, which is carbs, proteins, and fats. And we use primarily fats and carbs as energy. And so, our metabolic health is dictated by how well we use those carbs and fat to actually produce energy. And we want to be in this state of balance where we're using everything we're eating to function throughout our day and our body, doing all of the things it needs to do. Um, and if we're in a state of poor metabolic health, that's when our body really isn't great at utilizing that fuel. And so we either have too much in our bloodstream. And so you've probably heard of, diabetes and high blood sugar. Same with if you do a cholesterol panel and you see high triglycerides in your blood. That's a sign that your body's not using those fuel sources well. And that also means it's likely being stored. And when we store excess energy in our body, it's usually stored or can be stored as visceral adipose tissue or fat surrounding our internal organs. And having more visceral fat is a risk factor for things like cardiovascular disease and all of these long-term chronic diseases. But when we're focusing in the, shorter time frame and in the acute moment, we know that poor metabolic health is also directly related to poorer fertility outcomes. So less eggs being, or no, I shouldn't say that. I should say less or worse egg quality, sorry, less eggs retrieved from a cycle if you're going to do like an egg freeze or an IVF cycle, lower fertilization rates, lower implantation rates, higher risk for pregnancy complications. And then also what's so amazing about metabolic health and is mostly the reason why I'm so passionate about it is that when you get pregnant, if you have really good metabolic health, you are giving your offspring the best chance at a healthy life. So these impacts on our own body will impact the long-term health of the offspring. And that's whether, the eggs are being taken out of your body and used later, or if you're getting pregnant naturally and carrying a pregnancy right away. These metabolic impacts or the different changes we see within the body based around our metabolism impact our eggs right now as they are. And so if you're freezing your eggs, if you're trying to conceive, this is something that's really important. And so signs of poor metabolic health are things like excess adiposity or more fat, obesity, insulin resistance, and a lot of the general screening blood work that you've maybe done with even your family doctor, definitely a fertility doctor, can help us understand where you're at in terms of this spectrum of good to poor metabolic health. And so when we evaluate your metabolic health, we're taking into consideration many factors. But as I said, having high body fat or being overweight or obese, that is already telling us that your body's not in an optimal state of metabolic health because you are storing excess fuel, which is not ideal. And that could mean there's reduced overall fertility. And so We are moving away from certain definitions of, say, obesity or overweight. We're not using BMI as heavily, or we're really proposing a new definition of obesity to really focus on body composition. And when I say body composition, I'm talking about how much fat tissue you have and how much lean muscle mass you have. And the amount of lean muscle mass you have on your body is a really good indicator of your metabolic health, because that's the tissue in our body that is very metabolically active. And it's using a lot of that fuel from our food to function. So having lots of muscle mass, or a good amount of muscle mass, usually indicates better response to things like insulin, better response to or utilization to carbohydrates and fats. And so when we're focusing on metabolic health, one of the main outcomes should be to preserve or increase the amount of lean muscle mass you have on your body. And so when we think about muscle and we think about body fat, it sometimes feels very removed from fertility, but we do know that these things are going to have a direct impact. And so I'm here to answer a bunch of questions. It looks like some are coming through. And so please feel free to use the Q&A kind of button here to ask any questions throughout the call, and I'll do my best to answer all of them if I can. If there are any very individualized or very personal questions, we can always talk about what we can do with that, but it would probably be best to have a conversation, but I'll do my best to answer all of these here. So somebody wrote, what is the best weight for healthy eggs? Now, that's going to depend. Every person can function optimally at different body weights. And it's not just about the number on the scale. Again, I come back to this idea of body composition. And so in the clinic, we have a fancy machine that can tell you how much body fat you have, how much lean body mass you have, and that can really help us understand what's your optimal body composition and what do you need to work on? What are the goals that we need to kind of put into place for you to be in the best, most fertile state? And so it's not so much the weight. BMI is still, so BMI is when we take your height and your weight into consideration together. Like I said, it's not a perfect measurement, but we do use BMI a lot in the research, especially looking at fertility. And high BMI has been associated with less desirable outcomes when it comes to an egg retrieval cycle or actual conception rate. So longer time to conceive, higher risk pregnancies. And it's very obvious that high BMI can have an impact, but not everybody who falls within a high BMI category is metabolically compromised. And so it is something we always want to take into consideration, or with a grain of salt. And so it's not so much the weight, it's more what are you made of? That really helps us understand how metabolically active you are. How long does it take for a change? That's such a good question. When we're talking about changing your body composition and helping reduce body fat mass, we want to go slow and steady, especially if fertility is at top of mind, or conception. If we lose weight too fast, that can be seen as a stressor in our body, and we want to do everything in our power to reduce overall stress. There's enough stress in the world, and if we have high levels of stress, that can compromise our fertility as well. And so we want to lose slow and steady. Usually about 12 weeks is the minimum to see significant change. And a significant change, if we're talking about body weight, I know I just said it's not the perfect way to measure these things, but 5 to 10% reduction in your overall body weight is meaningful weight loss. So if you're losing 5 to 10% of your body weight, you will see improvements in a lot of these metabolic markers. So your insulin levels, your cholesterol, your blood sugar. Now, not everybody's going to see the same level of change, but that's the minimum time that we need to really have meaningful change. We also know in the research that looks at weight loss and fertility that 12 weeks is about that minimum to really get an impact on things like live birth rate. Okay. Will taking Ozempic, if you are diabetic, affect egg quality? So potentially, some people can safely utilize these types of weight loss drugs and have a really positive impact on their fertility, especially if there's a lot of excess weight to lose. And so, it can affect egg quality in a good way. We haven't seen any data to suggest that Ozempic or any of the other weight loss drugs can negatively impact your egg quality. And because it's going to help you utilize carbohydrates and then have an impact on insulin levels, which is that signaling molecule to get carbohydrates into the cell, this will have a positive impact at the level of the egg cell because insulin has a direct impact on egg quality. So high levels of insulin can be harmful to our eggs. Are there any supplements that help you lose weight? So the short answer is no. Nothing will ever cause weight loss if you're not focusing on other aspects of your lifestyle. But there are supplements that can help your body function while you're also moving your body more and eating the right nutrient dense food in a caloric balance. So yes, there are supplements that can help support lean body mass and supplements that may help with insulin resistance, but there aren't necessarily supplements that will help you lose weight if you're not mindful of your diet and exercise. Okay, these are great questions. Thank you so much. How can females maintain their body mass? So I think this question is really how do females maintain their lean body mass or their muscle mass? This is through proper exercise and eating a diet that's going to help you thrive, specifically focusing on protein. So especially for females, it's more challenging for us to maintain or build muscle mass. And so it requires a lot of protein. You need to be mindful about getting protein in at every single meal. It needs to be semi evenly distributed through the day because we want to constantly be triggering muscle protein synthesis, which we need at least 25 grams of protein in a sitting to do that. Now, ideally, most women need much more than that in each meal. But this is how we preserve lean muscle mass while we potentially lose weight on a caloric restriction. If you have adipose tissue or fat tissue you need to lose, but you can't grow your muscle without using your muscle. And so that's where exercise, resistance training, high intensity interval training come into play. And so we need to be focusing on both aspects, diet and exercise. Another question, if you lose weight, will you get more eggs from your egg freeze? So there's no definitive answer here, but we are seeing overall, with the research that's available, women who are in a state of optimal metabolic health or better metabolic health will have a better outcome with their egg retrieval. And so we know that people with higher BMI have less eggs retrieved and poorer egg quality. And so the reverse is also true. But obviously, very hard to answer that question. What about people that have lean PCOS or a healthy BMI? How can you tell what your metabolic health is? This is such a good question. And this is a perfect example of BMI versus body composition. So someone may be in a optimal state in terms of their BMI. So from, 18.5, 19 to about 24.9. But you may still have high levels of body fat. And I see this all the time. If you have higher levels of body fat, that's pro-inflammatory. And so you can have high levels of inflammation, you can have high levels of oxidative stress, which directly damages our egg cells and the DNA inside our eggs, has impacts on our mitochondria, and mitochondria inside the eggs are like one of the biggest factors to consider when we talk about egg quality. And so you can be a healthy body weight, you can look very lean on the surface, and you can still have high levels of body fat or become highly insulin resistant. And so that would be testing your blood, looking at your fasting insulin, your fasting blood sugar, and understanding your score of insulin resistance. Or there's even better tests out there, like a 2-hour oral glucose tolerance test that also tests your insulin. That can really help us understand if you're truly insulin resistant. And then also doing a body composition analysis. And that will help us really understand what is your metabolic health and what should the goals be. Okay. I've been told insulin resistance can cause infertility. There's a definite link between insulin resistance and compromised fertility. So, high levels of insulin can directly impact egg quality. They can impact placental development, implantation. We definitely know this. And dysregulated blood sugar, which is usually happening before we see that insulin resistance, that can have an impact at our the level of our eggs as well. So increasing the damage to the eggs or increasing oxidative stress to potentially reduce egg quality. So yes, insulin resistance definitely can impact your fertility. If I'm planning to freeze my eggs this year, are there still steps I can take to improve egg quality, or is it too late to make an impact? Also, incredible question. And so, what we know about the development of the eggs inside our ovary is that it takes about 3 months to 100 days for an egg to go from a primordial follicle or this kind of inactive cell that's been hanging out inside your ovary since you were in the womb to an active, ready to be ovulated egg. So that time frame of about 3 months is where we can really impact egg quality. And so if you have 3 months before you're considering any form of, egg freeze or trying to conceive, then you have, time to have an impact. Now, a lot of these, especially metabolic health, like a lot of the focuses here and the goals that we would be working on could potentially take longer than 3 months. But 3 months is kind of that like ideal starting zone of where we can have that impact. What are the best foods to eat to prepare for egg freezing? So, most research suggests a Mediterranean diet is going to be the most supportive for overall fertility. So, from healthy hormones, healthy eggs, healthy uterine environment, and pregnancy. Now, we don't need to put a label on any specific diet. I truly believe just a whole foods, high protein diet is what you need to be focusing on to really get all of the nutrient density you need. So, the folate and the iron and the zinc and all of these nutrients that are required to have healthy eggs and have implantation and a healthy pregnancy. And then high protein. We need protein to build every single cell in the body. And most women are eating less than optimal protein. And so, if you can just focus on eating foods that come in their natural form, so fruits, vegetables, lean meats, dairy, nuts and seeds, very low processed foods. So it's the ultra processed foods and the processed foods that we want to reduce or eliminate. Now, of course, there's always going to be an asterisk. For example, whey protein powder is maybe one of the most processed foods out there. And it's very supportive of things like our metabolic health and our body composition. And so there's always going to be exceptions, but overall, a whole foods diet is definitely what I would recommend to anybody trying to conceive. Is there anything one should be doing or not doing, eating, not eating to influence our reproductive hormones? So things like estrogen and progesterone. So, in a very similar answer to the last question, if you are getting most of your food from whole foods, you are going to be getting those building blocks, those nutrients that are necessary for our reproductive function. Fish, for example, as a protein source is amazing because it's got omega-3 fatty acids, which provides a lot of the building blocks for our cell formation. Um, we want to be avoiding the processed foods, the ultra processed foods. These are things that come in packages, in boxes, in bags. I'm sure you've heard this before, but in the grocery store, shopping the outside aisle, those foods that are generally good for your health are also really great for your fertility. And of course, there's certain foods we can focus more on, like the ones that are rich and deep in color, like the berries and beets and, broccoli, like the colorful foods that are full of polyphenols and antioxidants. Those are amazing to help protect our eggs from damage. So those are some of the foods. What I didn't fully answer that question. What should we be doing or not doing? So I mean, loaded question because we could go into everything. But if we want to go high level, like the things you should be doing are sleeping well, managing your stress really well, exercising regularly, eating whole foods, limiting your exposure to substances like alcohol, cannabis, smoking for sure is a no-no. Being mindful about toxic exposure in other ways, like the chemicals in your house, your laundry detergent, things that you're exposed to every day. If you're putting cream all over your body every single night, and it's one that has, a ton of parabens and all these other, potential exposures that we know have an impact on our fertility and our egg quality, then those would be areas that I would start focusing on. So reducing overall toxic burden. Hopefully I answered that question enough, but it really comes down to the basics. It comes down to eating, in a caloric balance. So we're not storing any excess calories in our body. We are getting lots of good nutrients from our food and we're avoiding toxic exposure. We're moving regularly. The thing that I love about fertility is like this or reproductive health, I should say, maybe is it's almost like a vital sign. So if you can just support your general health and wellness, your fertility will be better or, more in its optimal state. And if we know we're in a good state of health, we can assume that, our fertility is in a good place, or at least our egg quality. But these things are lifelong, right? Like we have to think about past medical history and past exposures. But if we're supporting our own optimal wellness, we are supporting our fertility and our reproductive function and our hormonal health. Now, there's always going to be unique differences. If you've been diagnosed with endometriosis, PCOS, if you have a specific condition that may impact your fertility, that's when you need to really go deep and work with somebody individually to get your own unique treatment plan. These are very generalized recommendations. Is eating a lot of protein good for fertility? So it depends on what you mean by a lot. So I generally recommend somewhere between 1.2 and 2.4 grams per kilogram of body weight per day. And so that's about like what 115 grams for someone who weighs about 140. That's not perfect math, but somewhere around that. Most of the research suggests that 1.2 grams is kind of like that minimum that you should be focusing on. Of course, we don't want to go too crazy and go beyond that 2.4, but most of the data that we have available shows that there's no harm in eating, a really high protein diet. However, it's not necessary. Protein is going to be really great for fertility because it's going to support things like your blood sugar levels. It's going to support your appetite so that you don't overeat, especially if you are trying to lose a little bit of weight before you conceive or before you do your egg freeze. It has aspects that are just beyond eating protein and utilizing that protein. It impacts our mood, it impacts our energy, and that impacts our choices. And so it can be very beneficial as part of just a healthy lifestyle. What is an ideal BMI range for fertility? So again, there's that big kind of asterisk here that you may fall out of this normal BMI range and still be very fertile and in an optimal state of health because BMI is not a perfect measurement. Some people have denser bones, some people have heavier organs. Like there's a lot of things that we need to consider. But if we're looking at what the research would identify as a normal BMI, especially for fertility, it's about, 20 to 25. Okay. Does taking high blood pressure medication affect egg retrievals? For me personally, it wasn't a weight issue, but a stress issue, unfortunately. So, I mean, it depends on the medication. You would have to talk through, whoever your provider is in regards to that specific medication. From my knowledge, I don't think there's any like just standard blood pressure medications that have a direct impact on egg quality, but that would be a very specific thing to be looking up with your specific medication and the dose of that medication as well. But high blood pressure in general is one of the factors that we take into consideration when we're talking about metabolic health. And so I mean, and stress as well. Stress is a piece that dictates your metabolic health. And so some of this may be related to metabolic health, which could have an impact on your egg quality, but high blood pressure medications alone are very unlikely to be impacting your egg quality or egg retrieval in general. Okay. Is there a good workout routine that one should be on to help with fertility? So there are many different routines that you could follow. The biggest takeaway in terms of exercise that I'd like you to walk away with today is that movement is very positive, and more movement is likely better unless you are very lean and you have very, very low body fat. We need a certain amount of body fat as females to have good reproductive hormone production. So things like estrogen and progesterone. However, I do definitely prefer resistance training for females trying to conceive because we're trying to build that metabolically active tissue. We don't need to go crazy. If you can do strength training 3 to 4 times a week, even for half an hour, it doesn't have to be drastic. That would be an amazing routine to follow. However, it extends well beyond the minutes within your workout. Your workout might be 30 minutes in a 24-hour time period. And what we see from the research is that movement throughout the day, all day long, may actually be more impactful on your metabolic health, like things revolving around blood sugar regulation, than the actual workout itself. So we do need that workout because we need that stimulus to grow the muscle. However, if we want overall good metabolic health and if we are trying to maintain a healthy weight, we also need to move every single day. Most of us sit at a desk and we are so sedentary, and that sedentary behavior has a huge detrimental effect on our metabolic health. And so, whether that's using like a step count or some other way to remind yourself that you've got to move, like I get my patients to set reminders through the workday to go run up and down the stairs 10 times. Any movement throughout the day is going to be very beneficial. And so, we need to consider that in addition to the actual structured workouts. Does high intensity interval training exercise cause stress to the body? Is lower impact exercise preferable for fertility? So, this is one of the huge myths out there. High intensity interval training actually helps your body cope better with stress. All exercise is going to cause an increase in our cortisol, but that's on purpose. Our body increases cortisol to liberate sugar so that we can use it as energy through a workout. What we care more about is what happens after the workout. And what we see with high intensity interval training is that we actually become more able to handle stressors if we practice high intensity interval training. And so it's actually the complete opposite of what most people think. Now, of course, high intensity interval training may not be for everyone, but I do believe it's a very effective form of exercise for a lot of women trying to either optimize their body composition or just stay generally metabolically fit while trying to conceive. Lower impact exercise, I wouldn't say is preferable. Now, we also have to remember we're not talking about when you're in cycle. I do want to just point that out. When you're in your cycle, your egg retrieval cycle, and you're on stimulation medication, this is a time where we're not promoting high intensity interval training and we are really focusing on just general movement like walking, maybe gentle stretching, because there is a risk of ovarian torsion. And so I just want to be very clear that we're not talking about when you're in cycle, but in that preconception window, I would always prefer high intensity interval training over lower intensity workout in the majority of people. What kind of exercises are ideal before egg transfer? Okay, so transfer is going to be different than retrieval because we're not talking about stimulation. Now, we always want to listen to our body and see how we're feeling, especially if you're on a medicated cycle or if you are in a natural modified cycle and there is some stimulation. Those are different situations. So you may not want to be active if you are on some stims in a transfer cycle. And so those people don't apply here. But if we're just talking about an estrus medicated transfer cycle, you can maintain your normal activity level. On the day of transfer, you'll want to take it easy. But a couple days after transfer, I get my patients moving again and getting back into their normal routine. The research on exercise in pregnancy is so strong that I truly believe it's harmful not to exercise. And that is also true around, the 2-week wait. We may want to reduce intensity a little, and there's always going to be an individualized prescription that's right for you. So you always want to talk to your medical provider, your naturopath, whoever you're working with. But exercise overall is generally safe within a frozen embryo transfer cycle. Okay, such good questions. Do you need to lift heavy weights to gain muscle, or do body weight or calisthenics work as well? So we do need some form of a stimulus. Body weight could be enough of a stimulus. If you haven't been lifting weights and you do body weight squats, that's enough of a stimulus to really change your muscle. As you get stronger and as your muscles adapt, you do need to constantly challenge them with more weight. And again, it depends on your goal. If you're trying to gain muscle, then yes, you definitely are going to want to increase to heavier weights. That might not be heavy, heavy, but it's going to be very case specific. If you're just looking to maintain good muscle function and utilize your fuel well and support your metabolic health, you can do that with body weight or other forms of exercise as well. You may not gain muscle from it. Okay. What foods are best to improve egg quality for someone over 40? So this kind of has been answered already, so I'm just going to quickly go over it. But there's not going to be a huge difference between someone who's 28 and someone who's 40 when it comes to food, because when it really comes down to it, if we're talking about egg quality, there's a point where you're going to need supplementation and you're going to need some good therapeutic dosing of antioxidants like CoQ10 and acetylcysteine, folate. Like you're going to need a different amount of egg quality support depending on your age and depending on your metabolic health, your past medical history. And so the diet will always stay the same. Of course, you can be even more mindful about, eliminating processed food altogether and getting more calories from nutrient dense foods like fruits and vegetables, organ meats, those kind of foods. But overall, the diet's not going to change based on your age. Okay. Can females conceive with fibroids? This is again a very individualized case here. It depends the size of your fibroid, where it's located, but many people conceive with fibroids. Many people have fibroids who, get pregnant naturally all the time. But there are some fibroids that may have an impact on your ability to conceive. And so I would definitely speak to your medical provider on that one. Can lifestyle changes improve egg quality quantity if there is already damage? Good question. So, I mean, we've seen in some research that, adding in antioxidants can actually correct egg quality and improve egg quality. And so, yes, like you can definitely have impact on your egg quality, even if there's potential damage or poor egg quality. And we see this all the time. With my patient population, a lot of the time people have gone through multiple cycles, whether it's egg retrievals or if it's an IVF cycle where they are actually trying to implant an embryo, where we see over, a couple cycles, really poor egg quality. And then we spend a good time working on preconception care and they have an amazing cycle, more eggs retrieved, better quality. And then, in a lot of those cases, a healthy pregnancy. And so, yes, we can definitely improve egg quality and quantity, but the degree to which we can improve these things is going to depend on the person and, what actual harm has been done or what we really know about your past medical history. Okay. How much fat and muscle is ideal for healthy reproduction in women? So body fat we do want to focus on. That's something that is important. So 18 to about 28% is kind of the sweet spot for healthy hormones, healthy egg quality. And so that's what I focus on. When it comes to muscle mass, there's actually not like a specific amount that you should have, but we need to look at the whole picture. So we look at, is your weight in a healthy zone as well as your body fat percentage, because then your muscle is probably in a good place. And so that one doesn't have a specific reference range, but body fat around, 18 to 28%. What strategies can you implement to cope with PCOS? So this is like the same. It's the same. There's insulin resistance likely. There's metabolic dysfunction happening in the background, and so we want to be supportive with a good balanced calorie prescription where you're not storing excess calories as fat. We want to focus on protein and reducing, refined carbohydrates that are going to trigger that insulin cascade. We're focusing on exercise. There's also a myth about PCOS and high intensity interval training and how, it's a no-no with PCOS. It's not true for every PCOS patient. High intensity interval training may be the best option for you if you have PCOS and you really want to manage your fertility and your metabolic health. But there's always going to be some individualized things. There's certain supplements that have more research with PCOS. And we know people with PCOS are more likely to have low vitamin D levels. So there's very individualized prescriptions that can be made based on your unique case. Okay, looking to do an egg retrieval soon. Would you recommend waiting and lose weight and being more healthy for a better outcome, or being the age of 43, would you recommend doing it earlier because of age? This is a very, very tough one. We know that age is the number one indicator of egg quality. And so as we age, we have poor quality eggs. So, not as great as when we were 35 or when we were 25. It depends on how much weight you have to lose. There are cases where I would say, wait 12 weeks, but maybe not beyond that. How much weight can we lose in that 12 weeks in a healthy way to really support your, egg quality and your unique needs? There is research that shows, based on your age bracket that you fall in, how much weight you would have to lose over a 12-week program to have a positive impact on things like live birth rate. And as you get into those older categories, there's more weight that would need to be lost in that 12 weeks. But you can lose 10% of your body weight for sure in 12 weeks. It just depends on how much you have to lose, sorry. And so this is, again, very like case by case. My recommendations would change depending on so many factors. But it's a hard one. It's a big decision to make. My wife doesn't have any issues. I have issues with my semen quality. Will there be issues if we go for IVF? So sperm is definitely important. It takes, 50% sperm, 50% egg to make a healthy embryo. And so yes, if there's sperm quality issues, we definitely want to be correcting those before you actually fertilize that egg. And there's lots that can be done from a preconception standpoint. So it takes about 90 days for sperm to develop from nothing to a full sperm cell that could be fertilizing an egg. And so it's a very similar time frame. And metabolic health is super important for men as well. So this is something that definitely should be addressed before you go through with IVF. Please talk about why or how fat tissue is inflammatory. Does high body fat percentage affect the pregnancy? So yes, we know that obesity and having a high body fat percentage can definitely affect the health of a pregnancy. Fat cells inherently are more inflammatory, and especially around our visceral organs. We don't want fat to be there, and so our body can mount an immune response. This levels, or this increases our systemic level of inflammation. So not just, inflammation around the organs, it goes to our blood and it goes everywhere. And that's why it can, affect the ovarian function and the egg quality, or, the uterine environment and implantation. So we definitely know that there will be impacts on, or there can be impacts on pregnancy outcomes. Is it better to eat everything organic? Also a hard one. This is going to depend on so many factors. If you told me you can't afford organic food, I would say, fine, go eat non-organic fruits and vegetables. If you can afford it, no problem. Yeah, like go for it. If you need to be choosy, go to the EWG website and look at the clean 15 and the dirty dozen, and avoid those, more dirty foods that are, more likely to be sprayed with heavy pesticides, and the clean foods that have less pesticide use. And this changes every year. So it is always updated on their website. I would say pick and choose the foods that you eat most often to be organic, and ones that, maybe you only have once in a while, like it doesn't matter so much. When we talk about meat, like if you can afford better quality meat, that's great. But if you can't, I'd still rather you eat, high quality protein from meat that's non-organic than choosing something else. So it's a tough one. I would say overall, it may not be the biggest factor to focus on. Can you use protein supplements? So, yes, sometimes we need protein supplements to actually reach the protein needs of our body, just based on our lifestyles. And, some people have a really hard time committing to eating lunch because they're so busy through the day. And so they don't eat lunch. Well, I'd rather you use a protein supplement and mix it in a shake or a smoothie and at least get in a good dose of protein in the middle of the day. So, using a protein supplement is definitely okay while trying to conceive, but it depends on the protein supplement, it depends on the other ingredients. And so you always want to look at all the ingredients and make sure you're choosing one that's going to be best for you. I feel like some of these we've answered already. How many times a year is the 12-week program offered at Conceive Health? Can you join the program if you are diabetic and are on metformin? So just for those who aren't familiar, we run a 12-week metabolic program at Conceive Health. This is a diet and exercise program. Where you follow a whole foods, high protein diet, and you commit to 4 exercise sessions a week, but you also gain accountability, support, and access to coaches, naturopaths. And so it really is a very holistic program. We do metabolic assessments to begin with, so a full metabolic blood work panel. You do a body composition test, and you're given a unique calorie, protein prescription, and then certain tracking tools and all these things that you'll have to use on a daily basis or a weekly basis to really be able to reach your specific body composition goals for your fertility. And so we offer this at Conceive on a rolling start now. So you can start at any time if this is something that you're interested in. If you've been trying to support your body composition, if you've been trying to lose weight, we know this is so hard to do on your own, and you're already potentially considering fertility treatments. It's a lot to think about. It's a lot to plan for. There can be a lot of stress revolving around these topics, whether you're egg freezing or whether you're trying to conceive. And so this is where the program can be a very nice support. We give you very firm boundaries. We really help support your goals, and we're there to really cheerlead as you go through the program. And so if this is something you're interested in, we have a discovery session that you can book with me, and we'll send that out after the call tonight with a recording of the video, and then also a link to book a discovery call and somewhere where you can go to learn more about the program. How do we feel about melatonin as a support for retrieval or FET, frozen embryo transfer? The bottle says if you take it longer than 3 months to talk to your doctor, is it okay for many months? So yes, long-term research on melatonin has been shown that it's very safe to take long-term. Melatonin is a potent antioxidant, and there's good research to show it supports egg quality and implantation rates. So it's something that I really like to use with a lot of fertility patients, but depends, of course, on your case. I have a retrieval coming up in 60 days. What are the most impactful changes I can make in that time? So this is where I would definitely get on a good exercise routine. Exercise is inherently anti-inflammatory. It's, going to increase circulation. It's going to reduce oxidative stress, reduce cortisol levels. And so exercise is definitely a big piece. And nutrition, really focusing on those whole foods that are super dense in those nutrients that we need for reproduction. Of course, you'll want to also consider things like egg quality support from certain supplements. That's something that you can always talk to an ND about, or your fertility doctor. But 60 days is still a good chunk of time. You're really impacting most of the life cycle of those oocytes or those eggs as they're growing in the ovary. So it's not like you're not at any kind of deficit. It's just, of course, the egg has already started to develop in the ovaries. If you're allergic to most seafood, is there another good source of protein with omega 3s? So, the omega 3 that our body can actually use that's bioavailable, so we can actually integrate it within our cells, comes from seafood or algae. If you're allergic to seafood, I would maybe opt for an algae-based food form or supplement. But when we talk about omegas coming from things like nuts and seeds and hemp, that's a different form of omega. So that's ALA. And sometimes our body has a really hard time converting ALA into EPA and DHA, which are the two omega 3s that we need for healthy hormones and anti-inflammatory properties and overall egg quality and pregnancy. Okay, so many questions. This is so good. I love that everybody's so interested in their metabolic health and changing their lifestyle for fertility. Okay. Can a fasted workout, exercise in the morning on an empty stomach, negatively impact fertility? No. Fasted exercise is not for everybody, but if you feel best working out fasted, I'd rather you work out than do something that makes you uncomfortable and then maybe not work out to the same ability. We do want to make sure we're adequately fueling after your workout, though, especially because you've just come off of a nighttime fast that's probably been 8, 10, 12 hours. And so, again, as females, really hard to maintain our muscle mass. We go into a catabolic or a breakdown state by the morning because we haven't had any fuel throughout the night. And so we will liberate amino acids from our muscle tissue and so break them down. And so we need to replace that. We need to give ourselves good protein in the morning to shut that process off and to help actually build muscle. So as soon as your workout's done, I would encourage you to have like a very high protein, nourishing meal. Okay. How impactful is hydration on fertility? Not drinking enough water. So, I mean, we definitely need to stay hydrated in general for overall functioning of our cells. And so, when we think about our cells, if we are dehydrated, I want you to picture like a wrinkly little raisin and those receptors and everything on the cell that should be out there primed, ready to bind whatever chemical messenger is there. They're kind of like folded on themselves. They're like in the cracks of the raisin. And so, with good hydration, we make our cells like these big squishy grapes. And that allows the receptors to be primed, ready, available, and everything works better that way. And that's true with also our oocytes or our eggs, like their cells as well. So for optimal hormonal signaling, for, just functioning of our body, we want to maintain a good state of hydration. It's very important. And then as soon as you get pregnant, you're creating amniotic fluid, your breasts are changing to create breast milk. And so hydration becomes even more important. So I would say that it's something that is necessary to focus on. And that's one of those like low-hanging fruits, something you can definitely start right away and is very easy to do and very important. What about women who are fit with very little body fat? Can this have a negative impact? So, yes, we know you need a certain amount of body fat to create healthy hormones and have that normal menstrual cycle. And so some women can function really well at a body fat of, let's say, 16%, and another woman could have a body fat of 18% and have no cycle altogether. And so it's very individualized. But if you see any changes with your menstrual cycle, if you're missing periods, if you're not ovulating, those are definite signs that your potentially overdoing it when it comes to exercise or underfueling your body. So if you are very fit, very active, we need to make sure you're fueling your body to support that level of fitness without actually compromising your reproductive function and your hormonal output. Okay. I know we're getting tight on time here. I want to make sure we're answering most of these questions. So many questions there, all so great. Would you recommend adding creatine to help with muscle? It depends, but creatine has a ton of research on its safety and on its impact on lean body mass. And so if you're struggling to put on lean body mass, that may be a good option for you, especially before trying to conceive. There's little data on creatine and pregnancy, although more is coming out. But right now, I would say I don't recommend it in pregnancy because we just don't know its safety profile. But before trying to conceive, when you're really trying to focus on lean body mass, I think it's a great addition for a lot of women or a lot of people in general. Okay. While focusing on a good diet and exercise routine, are there any supplements or natural things to do or take to help my chances in conceiving naturally? So, yes. And I think I've pointed to this a few times through the call, but there are so many agents that can be used and lots of really well researched ones. But it depends. It depends on your case, and this would be very individualized to you. So, if you need to, work with a naturopath. Our conceived team are all fertility focused NDs, and any one of us could help create a very personalized plan for you with all those supportive antioxidants and things needed for egg quality. What do you suggest in terms of limiting caffeine intake for fertility? I cut out coffee, but I drink black tea every day. Is this okay? So, most of the research shows that 200 milligrams or less of caffeine per day is safe while trying to conceive and in pregnancy. If you've experienced things like a very thin lining with transfer or potentially recurrent pregnancy loss, in those cases, we may discuss eliminating all caffeine or greatly reducing caffeine. If you're having one black tea every day, that is likely less than 200 milligrams. And so the research would suggest that that's safe while trying to conceive. Okay. If you previously smoked or vaped, how long before that damage is repaired, if ever? Again, so hard. I know these are not the most like satiating responses, but it depends. It depends on how long. It depends on how much. It depends on other factors in your life. We don't know, and because we don't have a test for egg quality, it would be really hard to understand how that smoking or vaping actually impacted your eggs. The only way we could tell is at a retrieval when the embryology team reports the quality of those eggs, and we watch those eggs grow into embryos. So, really hard to say. But stopping smoking and vaping is a very, important recommendation of mine. And stopping and supporting yourself with antioxidant can definitely have an impact on improving egg quality. What everyday products that are non-endocrine disruptors do you recommend? I think one of the biggest ones is anything you're putting directly on your skin every single day. So any kind of body cream or, soap, laundry detergent. These are ones that I usually direct people to the EWG website or the Think Dirty app. There's lots out there now, the Yucca or Yucca app. You can find really non-toxic, great like beauty products, cleaning products, and just household products. But the biggest ones would be anything that directly goes on your skin or in your lungs, anything that you would be spraying. So things like hairspray, dry shampoo, you're inhaling that right into your body. I'm sorry if I missed this, but do you recommend women take active CoQ10 prior to egg retrieval? If so, what does? Um, I'm not sure I completely understand the question, but CoQ10 is definitely one of the big antioxidants that I would suggest when prepping for an egg retrieval for an egg freeze or for an IVF cycle. Now, I know there are still questions that need to be answered. You can always reach out to me directly, or you can always book in at Conceive or book a discovery call with me. But I do want to just be mindful of time. So many great questions today. I loved answering all of those. Obviously, I'm super passionate about these topics and what we can do in our everyday life to really optimize our fertility, right from our egg quality to our uterine, our uterine environment to overall impacts on pregnancy. And so we will send you everything after. Likely tomorrow with a replay of the video, information about the metabolic program, and a link to book for those who have further questions or would like more individualized guidance. So thank you so much for joining us today. It was lovely to get to chat with all of you out there, and hopefully I'll meet some of you again soon. Bye now.